Welcome, M4s, to your anesthesia and pain medicine rotation. I'm Dr. Clemens, and I'm here to do your orientation. The first thing we're going to talk about is how to contact myself. My telephone number is listed here, and Lindy, she is our fabulous clerkship coordinator and will help you with all of your day-to-day needs. She can be found at her work number, on her cell number. Please don't hesitate to call us if you have trouble, or email. We're excited that you're here during this 2 weeks. We're hoping that you'll really enjoy yourself and learn a lot of new skills and knowledge. Most of the techniques that you learn during this rotation will help you no matter what you choose to go into. Most specialties will interact with patients that are undergoing surgery at some time in their lives, and understanding the pre-op, intra-op, and post-op management of patients and their pain control will really help you optimize your patients for surgery, and also help them navigate the perioperative period. Airway management skills are really helpful for every discipline, whether you're called to a code in the hospital or you're managing an emergency airway on the street. You will learn a lot of technical skills for airway management during this rotation. 80% of patients who visit the physician are there for pain complaints. This rotation will increase your knowledge about safer pain management. It's helpful no matter what field you choose to go into. The anesthesia and pain management clerkship is a required 2-week or 10-day clerkship. It's offered July through April and sometimes in May. Students rotate during their M4 year, and we have an average of 125 students per year. We also have electives, which are 4 weeks, and they are also offered July through April. Students rotate through Royal Oak Hospital, Troy Hospital, and Grosse Pointe Hospital, and we also use our ambulatory pain clinics. So we have a lot of learners coming through. We have residents from different specialties, medical students from different schools, the required clerkship, and CRNA students as well. So we do have a lot of learners in the OR, and we try to do our best to spread out our learners so that we're not crowded all into one area. The assignments will be operating rooms for 7 of the 10 days or 8 of the 10 days. And these operating rooms are spread through the different areas of Royal Oak, Troy, and Grosse Pointe ORs. The different areas of the ORs tend to specialize in different things. You will rotate through the various subspecialties of anesthesia, seeing cardiovascular, general surgery, obstetrics, pediatrics. You'll also rotate through Troy and Grosse Pointe, Corwell hospitals, so that we can, again, spread our learners out and maximize and optimize your experience. In the pain medicine experience, you'll have 2 days. One of the days is a lecture day. We'll have a variety of lectures from multidisciplinary pain specialties, and you will also come to our ambulatory pain clinics and rotate seeing the procedures that we do in the outpatient pain clinic, the medication management techniques, and you'll also see physical therapy. We all refer our patients to physical therapy, and it'll be great for you to see what they actually do there. For course objectives, by the end of the course, you should all be able to interpret information that you obtain in your pre-op history and physical. So one of the most important parts of an anesthesiologist's job is to determine if the patient is optimized for their surgery and that they're safe to move forward. The pre-op history and physical is the main way that we do that. So you'll be seeing lots and lots of patients in the pre-op area as they come through for their surgeries, and your task is to determine if that patient is optimized. Airway management is another really important part of our job. We'll discuss proper airway management techniques in both emergent and elective scenarios, and you might get to see both. We want you to be able to list and explain procedures that are outlined in the ASA's difficult airway algorithm. It's really important for all of us to know who are in the OR setting at any time what is the proper thing to do when you can't mask ventilate or can't intubate a patient. We want to demonstrate routine airway management skills, and you'll get your hands on a lot of different airway management techniques. We want you to learn how to place an oral airway, do mask ventilation, direct laryngoscopy, and LMA placement. We also want to make sure that you're able to discuss the principles and techniques involved in a balanced anesthetic. These include local anesthesia, regional anesthesia, and general anesthesia. Having a general understanding about the pharmacology of the common medications used, why we use them, and their risks and benefits to the anesthesia team and the patient will come gradually as you work through the weeks. But we want you to have a good understanding of the medications that we use during surgery. By the end of the course, you should be able to describe methods of intraoperative, postoperative, acute, and chronic pain control, and recognize the risks and benefits that come with that pain control. We want you to be able to develop multidisciplinary and multimodal treatment plans for patients with acute and chronic pain conditions. One of the most beneficial things that you'll learn is how to use different techniques to optimize pain control. We want you to demonstrate the ability to complete a focused history and physical, be able to present the history and physical to your attending, and produce a progress note that has a good assessment and multidisciplinary treatment plan for pain management. Professionalism is a really important goal for us. It's an important aspect of doctors and our medical training. We want you to project a professional image in your interactions with patients, peers, faculty, and coworkers. This means it's really important for you to be on time. The time to report to the pre-op area is a half an hour before your case starts. That's usually 7 a.m. Please come prepared to work, introduce yourself, be enthusiastic, tell the resident or attending that you're working with the goals you have for the day, and they will help you achieve them. Look for opportunities to learn, read about interesting patients that you've seen, and use the topic list that we provide. Stay the entire day. It is mandatory that students stay 6 hours at least. Even if you're excused early, go and read and make sure that you're there in the hospital, present and ready to work and see good cases for 6 hours every day. We want you to demonstrate compassion for the patients who are in a really stressful perioperative experience, and demonstrate teamwork and respect for all members of the team. To help document what skills you learn and where you are day to day, we do use a written procedure list. Everybody hates it, but it helps us keep track of you and who you worked with, and it helps us account for all the things that you do. So it's really important to us that you correctly fill out this procedure list. It's a requirement to pass the course. The procedure list documents the procedures that you've attempted. You do not have to complete them independently. In fact, all you have to do is attempt them with a good effort. These procedures will help you learn airway management skills and other techniques that will help you in your future career. Every line needs to be signed by the person who supervised you, and that should be a resident physician or an attending physician. Attendance requirements, another really important part of our very short 2-week clinical rotation. OUWB's policy says that students can only miss 25% of a rotation, and that means for this short rotation, it's only 2.5 days that are allowable to be excused absences. You have to stay in the hospital again for 6 hours a day. The clerkship coordinator needs to be notified of the absences so that we can keep track. Make sure that your procedure list is completed and that you attend mandatory sessions, which include pain lecture day and exam day. Your time and effort are really important to us. We hope you have a great time during this 2-week rotation, and we also hope that you learn some really valuable skills that will get you through emergencies more confidently and allow you to help your patients navigate the perioperative setting. Have fun and work hard.